is Justin Dorigo. I'm a clinical nurse specialist working for St John of God Healthcare at the Drug and Alcohol Withdrawal Network. Dawn is a government-funded project. We're essentially funded to provide a home-based detox service for people that are using alcohol and other drugs. So that involves the medical component of it, and most of us are mental health nurses, as I am. So there's a significant mental health component to the role. There's the kind of the physical stuff here, and then all of this stuff here that drives someone's alcohol or other drug use. Well, I guess my background originally in human services was welfare. That's where I started for the Salvation Army in supported housing. So mental health and alcohol and drugs impacted people's housing significantly, hence why they used a service like that. Then I retrained as a nurse, and mental health is my passion, but of course alcohol and other drugs is extremely closely aligned with that. The two really do go hand in hand. Very rarely will I see somebody with alcohol and drug issues that also doesn't have a significant mental health issue as well. So it was kind of a natural progression from working within acute psychiatry and then moving into what's a very, very good team of nurses still doing a significant mental health role, performing a significant mental health role, but getting that variety of alcohol and drugs as well. And the team itself, we're lucky in that we are only nurses. We don't have any other professions, so we can work with people really holistically, which is unusual in what nursing is. It's a medically dominated profession, so it's an unusual team and an unusual program where we can do some cool things. Look, I guess it's what people hope to achieve. It'd be really easy if I could come in and say, well, you should do this and this. This is obviously where your life should go, but it's not effective. So I guess if we were to use a recovery-based kind of model, it's to help people achieve what they see as their best level of function, where they want their life to be, and often that involves, as I say, you've got this small medical bit, but people kind of get lost in services, their mental health may not have been treated. So a lot of what we do is, I guess, referring people into appropriate longer term services to address some of those maybe underlying issues. The biggest challenge, again, would be the disconnect between mental health services and alcohol and drug services. So often people will approach mental health services and are told, well, no, your issue is an alcohol and drug issue. And sadly, they'll approach alcohol and drug services and they're really quite unwell, so that those services maybe aren't equipped to deal with that level of risk. And so these people are often left in limbo. It is improving as the Mental Health Commission and the Drug and Alcohol Office are merging. I mean, that's extremely exciting. So things are changing in Perth, but as it stands, that would head and shoulders above any other issues is that disconnect between the services, which makes clients' lives really difficult. People are in really difficult positions, and as an insider, I guess, I'm familiar with the services and I find it difficult sometimes. So for a consumer who's maybe got chaos in their life, isn't familiar with all the services, they give up as you would, because it's just too hard. Oh, look, when people are in really quite difficult situations, they may be depressed or their mental health may be really unstable, and they've got significant substance use. Maybe they've got housing issues. They've possibly got comorbid health issues, and some people just really turn themselves around, and it's really exciting. Some people just have come from unimaginable backgrounds filled with trauma, and the resilience that people show is just really, really exciting to see, and it does, it makes it worthwhile. It's nice, it's a privilege. Well, I guess for some of those reasons I talked about, it is genuinely rewarding. If we looked at the spectrum of human services, I guess I'd probably more broadly say not-for-profit services as a whole. You're there helping people, walking alongside people, and really sharing some quite precious moments with those people, and just seeing some amazing transformations